Good morning, Mr. Francisco. My name is Cynthia. I'm a student nurse practitioner, and I will be performing your abdominal exam this morning. Will you consent to being videotaped and published on YouTube for educational purposes under unlisted?
Yes.
Okay, thank you so much. And I went ahead and washed my hands. So my hands are clean. I washed them prior to recording the video. Okay, if you can go ahead and lie on your back, Mr. Francisco. Go ahead and relax your muscles. I'm going to go ahead and lift your shirt up. And our first part of the abdominal exam will be inspection. What we look for here is for any asymmetry. We look for any peristalsis, any striae, any vein distension that would indicate portal hypertension. We also look for any scars, any surgical scars, for discoloration. If there's any yellowish discoloration on the abdomen, we make sure that we look at the sclera of the eye. The sclera of the eye, if it's yellow, that would indicate jaundice. In this portion of the abdominal exam, Mr. Francisco seems to have normal findings. Now we will move on to the auscultation portion of the exam. I will be auscultating all 4 quadrants, with the umbilicus being the center of the quadrants. And I will auscultate for any hyper or hypoactive bowel sounds. And I will also be listening to a hepatic friction rub on the right upper quadrant or a splenic friction rub on the left upper quadrant. So I will start with the right upper quadrant, listening for any abnormal bowel sounds there. Okay, so we hear normal active bowel sounds on the right upper quadrant. And while I'm here, I'm going to go ahead and listen with the bell of my stethoscope. I'm going to go ahead and listen for any hepatic friction rub right underneath the costal margin with my bell. And I don't hear any hepatic friction rub there. Now we'll move on to the left upper quadrant and listen to bowel sounds there. And there are normal active bowel sounds. Now I will listen for any splenic friction rub, also right underneath the costal margin with the bell side of my stethoscope. And I don't hear any splenic friction rubs. Now I will move on to the left to lower quadrant, and I will listen for any abnormal bowel sounds there. And there are normal active bowel sounds on the left lower quadrant. I will move on to the right lower quadrant and listen for bowel sounds there. And there are normal active bowel sounds on all 4 quadrants of Mr. Francisco's abdomen. Next, I will listen for any bruits in the aorta. We will find the aorta, it's under the sternum, and it's right in the middle between the umbilicus there. And I will listen for any bruits first with the bell portion of my stethoscope. Now with the diaphragm. And I did not hear any bruits in the aorta. The aorta then branches off into the right and left renal arteries. So the renal artery is right beside the aorta, a little bit below, and we will listen to the right renal artery with the bell portion of my stethoscope. And we will also listen for any bruits there. Now with the diaphragm, no bruits there. Now we will move on to the left renal artery with my bell portion. Now with my diaphragm side. And no bruits heard on the left renal artery. Now the renal arteries branch down into the right and left iliac arteries, and they're right beside the umbilicus, a little bit on the lower side. I will listen to the right iliac artery with the bell. We will also listen for any bruits. Now I will listen with the diaphragm side. And no bruits heard there. I will move on to the left iliac artery with the bell portion. Now I will listen to it with my diaphragm. And no bruits heard on the left iliac artery. The left iliac arteries now branch off into the right and left femoral arteries. And we will go down to the right femoral, and I will listen to the right femoral with my bell. And now with my diaphragm. No bruits heard on the right femoral artery. Now I will move on to the left femoral artery. Listen to it with my left, with the bell, I'm sorry. Now I will listen to it with my diaphragm side. And no bruits heard on the left femoral artery. Now we'll move on to the percussion portion of the abdominal exam. I will be percussing all 4 quadrants of the abdomen, listening for any dullness. We should be able to have a tympanic sound on all 4 quadrants. I will also be percussing the liver for liver span, and also we will be percussing the spleen being on the left upper quadrant, the liver being on the right upper quadrant. So we will go ahead and start with the right lower quadrant first and move up our way up. Listening to make sure we don't hear any dull sounds. So we heard timpani on all 4 quadrants, which is normal. We should be able to listen to timpani and not dull sounds. Now what I will do is I will percuss for the liver span. We want to see how big his liver is. So the way we do that is we look at the midclavicular line, and we go all the way to the bottom parallel to the umbilicus. And we will start percussing our way up towards the nipple line. Once it transitions from tympanic sound to dull, we make note where it transitioned into a dull sound, and that will be the border of our liver. Okay, so now it's transitioned into a dull sound. So this will be the border of our liver, and then we will move up, we will make note of that point. Then we move up into under the nipple line, and then we will percuss our way down until it transitions from tympany to dull, and that will be the top side of our liver. Okay, so this is where it became dull, transitioned from tympany to dull. So here we have our liver span of approximately maybe 6 to 7 centimeters. The normal for a liver span is 6 to 12, but it does vary depending on whether the patient is male or female. Usually males have larger liver spans, or if the patient is short or tall. So he seems to have, Mr. Francisco, a normal liver span. So now we are moving into the left upper quadrant, and we will be percussing the spleen. Now with the spleen, we will look to see, find the anterior axillary line, which is right over here. And what we will do is we will percuss the spleen, and we should be hearing a tympany sound throughout the whole percussion of the spleen. If we hear a dull sound, that would not be normal. So let's start percussing. Moving towards the rib there. And we did hear a tympanic sound throughout the percussion of the liver. So that's a good thing. It's not abnormal. Okay, so now we have completed the percussion portion of the abdomen exam. So now we're going to go ahead and move on to the palpation portion. And we will be palpating all 4 quadrants of the abdomen. We will also be palpating for the liver border on the right upper quadrant and the spleen on the left upper quadrant. So what we're looking for here is we're looking for any abnormal masses, any lumps. We will start with light palpation, and this will get the patient used to the feel of my hands and the touch. And we should be able to lightly palpate first. We'll start with the right, we're going to move towards the right upper quadrant. We'll start with the right lower quadrant. And as we're doing this, we're looking at the patient because we want to make sure he's not experiencing any pain. And we're just doing a light palpation, feeling for any masses. And we're walking our fingers, making sure that we don't miss any portion. We're moving up into the left upper quadrant. That way we don't miss any masses. And we're moving down into the left lower quadrant. I'm also palpating over the bladder, making sure that there's no tenderness, looking at our patient, that they're not grimacing with pain. And we should end up back into the right lower quadrant. There was no grimacing, no signs of pain. I didn't feel any masses or any nodules. But now what we're going to go ahead and do is we're going to move into the deep palpation. So if we missed anything in the light palpation, we sure will not miss anything with the deep palpation. So we will do the same pattern, move from the right lower quadrant all the way up to the right, the upper quadrant, left upper quadrant, and then back down to the left lower quadrant and work our way up back down to the right lower quadrant. And this will be deep palpation, Mr. Francisco. So you'll feel a little bit deeper palpation here. Right lower quadrant, walking up to the right upper quadrant, going up into the left upper quadrant, making sure we don't miss any spots, moving down to the left lower quadrant, over the bladder, looking at our patient, making sure that there's no pain, and ending up into the right lower quadrant. So there were no grimacing, there were no signs of pain. I did not feel any masses, any lumps. So now what we're going to go ahead and do is we are going to check for the liver border. So the way we're going to do that is we're going to find the costal margin, which is right in this area. I'm going to go ahead and place my right hand under the right costal margin, and it's in the right upper quadrant. We're going to be feeling for that liver border. So at this point, I'm also going to be checking for Murphy sign. And if there's a positive Murphy sign, the patient will experience pain when they inhale as I press down under the liver, the right costal margin. And what that is that signifies a sign of, signifies cholecystitis, which is an inflammation of the gallbladder. But at the same time, I will be feeling for that liver border, so we can do two things at once. So right under the costal margin, I'm going to go ahead and press into the costal margin and down, a deep palpation. And Mr. Francisco, go ahead and take a deep breath. Make sure there's no pain. And I did feel that liver border, which is good. It's normal to feel the liver border. And there was no pain elicited, which means that the Murphy sign was negative. So we don't have any concern of any gallbladder, any cholecystitis issues. Now we're moving up into the left upper quadrant. We're also going to find the left costal margin, which is right here. And what we're going to do is we're going to find the spleen to see if we palpate the spleen. Now, it is not normal to feel the spleen. If we feel the spleen, then that means that there's some splenomegaly going on. So we're also going to ask Mr. Francisco, we're going to do the same thing. We're going to have him take a deep breath as I push into the costal margin and down deep under the costal margin to see if I feel any spleen there or splenic border there. Okay, Mr. Francisco, go ahead and take a deep breath. I did not feel any splenomegaly, so that's a very good sign. So the palpation portion of the abdominal exam appeared to be normal. Now we are going to perform a few special tests. One of them is called the fluid wave test, and what it does, it tests for any ascites, any fluid in the abdomen. So what we'll do with this, we're going to have Mr. Francisco place his hand firmly on the umbilicus. And what this does, it will help prevent any internal organs from shifting as I perform the test. So what I will do is I will place my hand on the left-hand side of his torso and then right-hand side of his torso. And I will make a sudden push towards my left hand. And if I see a wave pull from the right to the left and hit against, slap against my left hand, then that would be positive for the fluid wave test, and that would be positive for ascites. So what I'm going to go ahead and do is I'm going to make a sudden push, and I do not see any shifting of fluid or any slapping against the left side of my hand. So he is negative for the fluid wave test. So now what we're going to go ahead and do is we're going to go ahead, if we find any symptoms of appendicitis, one of the tests that we can perform is called McBurney's point. And what it is you'll find your umbilicus and you'll find your anterior superior iliac spine, which is the hip bone. It's right here. So between the two margins there, we're going to go ahead and find that middle spot. And what we'll do is we will be palpating deep into that middle spot. And if there is any pain elicited when we do that, that would be positive McBurney's sign, McBurney's point. If you let go suddenly from that spot once you press deep, then that's called rebound tenderness, and that would also be positive for appendicitis. So we can do both at the same time. So I'm going to go ahead and I found my McBurney's point, and we're going to go ahead and press deep into that point. I look at my patient, I don't see any signs of any pain. And as I'm letting go, see if there's any pain, there's no pain. If a patient with appendicitis were to have this done, there would be extreme pain and you would know it from the pressing down and from the letting go as the rebound tenderness. And that would be positive for appendicitis. Next, we are going to go into our final step of the abdominal exam. We will be testing for CVA tenderness, and what that test is for, it will test for any polynephritis, and what it is we will test to see if there's any pain in the kidney areas, any pain elicited, which would signify an infection of the kidney. So we'll go ahead and have Mr. Francisco stand up. Okay, and we'll go ahead and have your back facing the camera. I'm going to go ahead and lift your shirt up, lift your shirt, and I'm going to go ahead and find that spine. And it's usually at the 12th intercostal space, which is right here. And what I would do is right next to the spine, I will place my hand in that 12th intercostal space, and I will place my fist over my hand, and I will strike, make a sudden strike. And if the patient expresses any pain, that would be positive for a possible kidney infection. Now I'm going to go ahead and have Mr. Francisco turn this way, and I will do the same thing on the opposite side on the right CVA area, and I will also do the same thing. Of course, I would be standing in that direction, but due to the camera, I have to do it this way. But I would place my fist and I will strike. And if there is any inflammation of the kidneys, that would show that the patient, we need to investigate further to see if there's any infection in the kidneys. So this concludes our abdominal exam, and I would like to thank Mr. Francisco for his cooperation. Thank you.
You're welcome.